Hello everyone, my name is Desha. Welcome you all to this new session of Fundamental of Nursing. So in today's session, we are going to deal with a very small topic, that is the hygiene. Hygiene is derived from the Greek word hygieis, meaning healthy or sound. This hygiene is very important to be maintained because if it is maintained, especially the personal hygiene, then it helps to promote the health of an individual as well as prevent from any infectious diseases. Personal hygiene may also be described as the principle of maintaining cleanliness as well as grooming of the external body. It includes all the cleansing and the grooming activities that helps to maintain the personal cleanliness and appearance of an individual. Well, people are ordinarily responsible for their own hygiene, right? However, the personal hygiene practices may vary widely from one person to the other. So as a nurse, it is one of your responsibility that you must educate the family members as well as the patient himself of the importance of the personal hygiene. Because here good hygiene or personal hygiene not only helps to maintain a healthy self-image, but it also helps to prevent the spread of any infections or diseases. So here being a nurse, you must provide the maximum opportunity for the patient to take care of his or her own hygiene. However, when you encounter client who will not be able to do so because of their condition, then it is also your duty to assist them. And also here, the more ill the patient is, the more skill is needed in order to provide this hygienic care. And as we all know that cleansing skin is the first line of defense against any microorganism, right? That is why it is very important that each and every individual must always maintain a good personal hygiene. So now let's move on to the definition of hygiene. Hygiene is defined as a branch of medical science which studies of regularities, shows how the environment has a direct influence on the human health, with the purpose of substantiation, diagnostic, treatment, as well as prevention measures among the people. So this is the branch of science which shows the regularities of how the external environment in which one lives in has a direct influence on the human health, with the purpose of substantiation, diagnostic, treatment, as well as the preventive measures which one may take in order to promote their health. So here, in simple words, we can also say that hygiene refers to the condition and practices that helps to maintain health as well as prevent the spread of infections. So here, when one is able to maintain his or her own personal hygiene as well as the hygiene of the environment in which he or she lives in, then this will help to promote the health of an individual as well as prevent the spread of the infections or diseases. So now when we talk about personal hygiene, these refers to all the steps which we will be doing in order to keep our body clean. So here, the regular routine of personal care includes washing and grooming of hair, face and skin, teeth, ears, hands, nails, and the feet. So in order to be able to maintain a good personal hygiene, it is very important that we must groom ourselves well, and not only that, but we must make sure that we must wash our hair, we must take care of our face and skin, brush our teeth, clean our ears and nails, as well as wash our hands and feet, right? So here it's very important that we must maintain our own personal hygiene. So here, in order to keep yourself clean, it's very important that you must at least take bath once a day so that you will be able to clean and groom yourself well. So being a nurse, even if they will not be able to perform these activities, you must try to assist them. That is, you can take care of their hair, wash it and groom them well. You can also perform the nail care, eye care, ear care, and also you can provide sponge bath to them. So what are the factors that influence these hygienic practices? Here there are a list of factors which include the social practices, the personal preference, the body image, the socio-economic status, the health belief and motivation, the cultural variables, the developmental stage, as well as the psychological condition. So these are the 8 factors that commonly influence the hygienic care of a person. So in order to get a clear idea of it, let us discuss about each one of it in detail. So the first one is the social practices. Here the social group influence the social preference and practices. including the types of products used as well as the nature and the frequency of the personal care practices. So here, the social practices which one follows can also differ from one person to the other, because there are some social groups which has a direct influence on the social preference and practices, such as the type of hygiene products which they should use, and also the frequency and the nature of personal care practices. This can also differ depending on the age of a person, right? When we talk about the infant as well as the young children, they will not be able to take care of their own health. They will not be able to maintain their own hygiene. So here it is the responsibility of the parents as well as the caregivers to make sure that their hygiene is maintained. And also here the family custom plays a major role in determining the hygienic practices which one must follow, especially during their childhood period. Why? Because here whatever you do, especially to the children's, here it will have a direct effect, and this will always be a part of their duty which they will be performing even in the years to come. So here it is best that you must educate and train the children in the younger age itself of what are the various hygienic practices they must follow, such as the frequency of bathing, the time of brushing, as well as the time of flossing. So here, if you have taught a child to brush twice a day from the younger age itself, then he or she will follow this routine even in the years to come. However, if he was taught brushing only once a day, then he will still continue with this, and it will become difficult for him to follow the routine of brushing twice because he was not taught in his younger age itself. So here not only the family custom, but as these children enter their adolescent period, the peer group as well as the media often influence their hygienic practices as well. For example, as we have all seen that young girls, as they enter their adolescent period, they become more sensitive to their appearance, and they also start using various beauty products. So this is the reason why the social group, the social practices, the family custom which one follows also has a direct influence on their hygienic care practices. And the second one is the personal preference. Here, as we know that every individual is unique, right? Everyone have their own preference. So even when it is regarding these hygienic practices, then each and everyone may have their own preference about when to perform hygiene as well as the grooming care. Some may prefer to shower, whereas some may prefer to bath, and as well as the beauty products which one will be using, or the hygiene products which one will be using, will also differ from person to person. Therefore, as a nurse, whenever you have to take care of your patient, you should make sure that you know their personal preference in order to promote the individualized care. You can also help the patient to develop a new personal practices when indicated by an illness or condition. So this is the reason why the personal preference of an individual is also one of the factors that can influence the hygienic care. And the third one is the body image. The body image is a person's subjective concept of his or her body, which includes their personal appearance, their structure, as well as the function. Sometimes this body image can also affect the way in which one maintains his or her own personal hygiene. So here, as a nurse, if a patient maintains a neatly groomed appearance, you must be sure to consider the details of the grooming before you plan for the care. And you must also consult with the patient before you make any decision of how to provide this hygiene care to them. And when you encounter a patient who seems to be uninterested or unkempt in maintaining his or her own hygiene, then it is your responsibility that you must educate them on the importance of maintaining his or her own hygiene, as well as make the further assessment regarding their ability to participate with the daily hygiene. So here the interest of a person can also affect the maintenance of the personal hygiene, as well as if the patient has just undergone any surgery, illness, or change in the mental as well as the functional status, then this can often affect the patient body image. Here, not only that, but also discomfort and pain, stress life, or fatigue can also diminish the ability of an individual to maintain his or her own hygiene. So extra effort is required by the nurses in order to promote the hygiene and grooming of that particular individual. So here, in order to maintain this hygiene practices, it is important that you must educate them as well as assist them in case if they are not able to do it because of their disease condition. And the next one is the socio-economic status. So here, a person economic resource also has a direct influence in the type and extent of hygiene practices used. So here, as nurses, it is very important that we must get a clear idea of the condition of the client, because these clients who are not well off may not have or may not be able to afford the desired basic supplies such as the deodorant, the powder, the shampoo. That is why it is said that this socio-economic status can also directly influence the hygienic practices which one may follow, because here there are some people who has the ability to take care of his or her own hygiene but may not be interested to do so, whereas there are also some of the people who are interested but because of their condition they are not able to buy the desired basic supplies, which then makes them look unhygienic as well as unkempt. And the next one is the health belief and motivation. So here, knowledge about the importance of maintaining hygiene and implications for well-being also has a direct influence on the hygienic care of an individual. However, this knowledge alone is not enough. Motivation is also required because this plays as a key role in the patient's hygienic practices. So how can we motivate the patient? We can motivate them by educating them about the importance of maintaining one's own personal hygiene, of how this hygienic practices which one follow can help them to promote their health as well as prevent the spread of infectious diseases. You must also provide information that focuses on the patient health related issues which is relevant to the desired hygienic care behavior. So whenever you encounter any client who seems to be less interested to maintain a good hygiene of himself or herself, you must make sure that you motivate them, you educate them, you provide them the necessary knowledge, the necessary information which they should know in order to promote their health. And the next one is the cultural variables. So here the cultural beliefs as well as the personal value which one follows can also influence the hygiene care which one follows. Here people from diverse background also follows different cultural self-care practices. And also maintaining cleanliness does not hold the same importance for some ethnic or social group as compared to the others. For example, in North America, it is very common that people bath and use deodorant daily in order to prevent body odor. However, there are people from certain cultures that are not sensitive to these body odors and prefer to take bath less frequently. Some homeless people also believe that a layer of dirt helps protect them from becoming sick. That is why even they choose to not take bath daily. So as a nurse, whenever you provide care to the patient, you should not show any signs of disapproval of their hygienic practices, as theirs may differ from yours. So here, yes, you can educate them, but you should make sure that you do not force them to change their practice until and unless the practice which they are following is affecting their personal health. So here the religion, the cultural belief as well as the personal values also has a direct influence of the hygienic care practices which one follows. So here the religion, the cultural belief as well as the personal value also has a direct influence on the hygiene practices which one follows. And the next one is the developmental stage. So here this developmental stage is also one of the main factor that affect the ability of the person to perform his or her own hygiene care or even the type of care which is required. So here as a person ages, it becomes difficult for them to perform his or her own hygienic care, right? So that is why you might have seen that as a person ages, he or she will not be able to maintain their own personal hygiene as they used to in the years before. And the next one is the physical condition. So here, any person with certain types of physical limitation or disability which is associated with disease or injury, or if there is lack of energy, and dexterity to perform the hygiene self-care safely, then he or she may not be able to maintain a personal cleanliness. If a person also has certain acute or chronic cognitive impairments such as stroke, psychosis, and dementia often result in the inability to perform the self-care independently. So here the condition which a person is in may also limit the self-care which they will be able to perform independently if they were in a good condition. So here the condition in which the person is can also limit the self-care ability which they may be able to perform independently if they had the necessary strength or power. So these are the various factors that influence the hygienic care of an individual. So now here we have come to the end of this topic, whereby in today's session we have discussed in general about what do we mean by hygiene, why is it important for us to maintain our own personal hygiene, and what are the various factors that influence the hygienic care of an individual. So I hope you have got a clear understanding of this topic. I'll be meeting you in another session whereby we will be discussing about the various care which you can provide to the patient who will not be able to maintain his or her own personal hygiene. Until then, have a good day. Thank you.